Night school.
Night school.
So I'm halfway through, maybe 2/3 of the way through Cure, A Journey into the Science of Mind Over Body by Jo Marchant. Female, by the way, J-O, kind of Joe. Rewire Your Anxious Brain, How to Use the Neuroscience of Fear to End Anxiety, Panic, and Worry is another book that I read. I read most of it like a month or two ago. Just finished it this week or last week. That one's by Pittman and Elizabeth Karle, maybe Karle. I found some interesting connections between these books, so I decided to just throw them on here together. I'm going to finish this book in the next week, so maybe I'll just do 1.5 for that one too. I don't know, but they're fun ideas to talk about, so let's get into it. So Cure was recommended by HMI, the hypnotherapy school that I'm going to, because it has interesting evidence about the role of the mind in even explicitly physical ailments. And the book launches straight into some of the wildest examples of placebos being successful. The craziest one is a surgery called vertebroplasty, which involves injecting cement into bones to strengthen them. It was found that I cannot believe they got this by an ethics board. Placebo surgeries were as effective. They put these people on the table. They didn't tell the surgeon if it was a placebo surgery or a real surgery until the person was already out, so that there was no indication to the patient. Patient was put on, whoops, I hit the, okay, it's good. They were put on, what the hell do you call it, anesthesia, and they poked a needle into him and everything. The only difference is there wasn't a cement injection in the needle.
So it is a real procedure.
Yeah, it's a real surgery. Vertebroplasty is a real but not very common procedure.
Okay.
But in this study, comparing that surgery to placebos, the placebos were as effective.
Whoa.
So, no, I'm so sorry. It was in half. In half of the cases, placebo were as good because it was.
Okay.
They did a lot of studies on this. Wait, no. Hold up, I'm getting these mixed up. Okay. First, the placebos were as effective as vertebroplasty. Second, there was an analysis of 53, like this was a meta-analysis where they review a bunch of studies and make a general summary. 53 controlled studies comparing a series of minor surgeries, and in half of the cases, the placebos were just as good. But in vertebroplasty, it was absolutely just as good. And then
placebos in the vertebroplasty example, placebos were as effective?
Yes, and that's in as effective based on patient reporting of symptoms. So that's not saying that the bones were as strong,
right?
But saying that the patients were like, yeah, it worked. I feel way better. I got all my strength back.
I wonder if that's partly because people...
You're going to have to get closer to the mic. I think you'll have to adjust it up because look at our sound waves right there.
I got those bitchy little sound waves.
I got mine like an inch away from my mouth.
Okay. That's crazy. How? Okay.
That was a honking sound wave. No, they're not still small. It's just not zoomed in far enough for you to see the change. See? I still got some little baby bitch sound waves. Dude.
Okay.
I don't know.
I'll work on it. I'll work on it.
Okay, so Parkinson's was another crazy one. Placebos are super effective for Parkinson's. A lot of Parkinson's patients, they observed that their symptoms would start improving before the medication even hit them. And if they were given placebos, then they would start shaking way less as well. But something else is interesting is that the brain rushes with endorphins when people take placebos because they've done like MRI and EEG monitoring while people are taking placebos, and the endorphins go up. And if you give somebody an endorphin blocker and then give them a placebo, then the placebo will not work. So it's evidence that there's a direct connection between positive thinking and the change in your symptoms.
Totally.
But in almost all cases, the actual illness doesn't get better. Only the person's experience of it does. Like if you give an asthmatic an inhaler that's not real, they will say, yeah, my breathing cleared up. But if you do x-rays on their lungs, their lung capacity did not change. Their lung function did not change. So it's mostly just the experience that's changed. But there's a quote that comes up in the book from the Buddha, which was, because they did a little section on mindfulness near the end of it, the Buddha said that pain is 2 arrows. The first pain is the... I always like I do this so often. I launch into quotes and then I don't actually know the quote.
Just swing out a vine and there's not another one waiting.
But there's trees. So the first pain of the arrow is the actual pain, and the second arrow of pain is the idea that you attach to the pain.
Okay.
There's another quote, pain is inevitable, suffering is optional. And then the metaphor was there's two arrows. The first one is the physical pain, and the second one is the ideas that you attach to the physical pain. And so the idea,
I like that.
Yeah, and the idea is that if you can eliminate the psychological pain that normally accompanies the ailment, the most of your suffering is gone. And here, let me go through some other examples. So Prozac, barely better than placebos. Valium, not better. Valium does not work if you don't know that you've taken it. Also, this is really interesting. So a nocebo is when you are convinced that you are going to be harmed by something, and you actually experience being harmed by that thing. And placebo is you experience that something's going to make you well, and you experience actually getting well.
Okay.
So an example of a nocebo, actually this one wasn't in the book, but it's my favorite one. There was this tribe where these people were told that if they left, they would be cursed, and this demon would come kill them. And when they left the tribe, they would die in their sleep. It was like 4 or 5 of them died in their sleep after moving away from this village.
Whoa.
And another one that was in this book, this dude in...
well, I suppose that also could have been a demon, right?
Could be, but even if like actually, here's a really relevant kind of rebuttal. So there was a guy who was given a voodoo curse, and there was this doctor who was trying to help him, but he just could not convince this guy that he was better. He was trying to treat the man because the man was having what were the symptoms? It was something digestion related. And he was like, this is going to kill me. And the doctor went to his family and said, can I just lie to him? Can I just make something up? And they're like, yeah, do whatever you want. So he gave the guy some crazy, what are the pills that make you shit?
Laxative.
He gave the guy a bunch of laxatives, and the guy shit his brains out, and then he just pulled a lizard out of his pocket and went, look, it came out, this was it. And the guy's symptoms absolutely and completely cleared up. And so I think that there is room for the possibility that the demons and the spirits are real, but still that they don't get access to you if you don't choose to give them access, and that they can trick you into giving them access by convincing you that they have access.
Sure.
You know what I mean?
Yeah. There's room for placebo in the demon world,
for sure.
Aside from the medicine world, yeah.
Yeah, for sure. So, like the case of the people moving out of the tribe, maybe the demon was real, but it only got them because they thought it could. Even if voodoo is real, it only works if you think it does. And, it could be that things have happened because of voodoo curses that seemed impossible. But that you still could have just done those things without the voodoo ritual if you just would have believed it. If you just for some reason found a way to believe it. So, another really funny one was this guy in Jackson, Mississippi. He was in a trial, and he had all these pills, and he got in a fight with his girlfriend, and he took the whole bottle of pills. His heart rate crashed, his blood pressure crashed. He went to the hospital. He was dying, he overdosed on purpose. And then the trial got word to the hospital that he had been given a placebo, and they told him, you took placebo pills, and all of his symptoms cleared up. Blood pressure, heart rate went back to normal. He crashed his own blood pressure and heart rate just thinking that he had taken all of these pills.
Wow.
There's an IBS trial, irritable bowel syndrome. They were comparing fake acupuncture to no treatment at all to real and compassionate acupuncture.
Okay.
28% of the people who had no treatment felt better just for having participated in a trial. I think they just showed up somewhere, and there was some authority around. And just from being there, they said that they felt better, 28%. 44% who got fake acupuncture said that their symptoms cleared up. And then 68% who got warm, compassionate acupuncture actually cleared up. Acupuncture is a funny one because there is one doctor in this book that, and by the way, Jo Marchant, she is not a physician or a scientist or anything. She's just a really, really good journalist who just tackled this issue and flew all over the world interviewing people and did an incredible job. Because she's a writer, and so the book is really, really easy and fun to read.
Nice. And
she had to have cited 500 studies in this book and interviewed at least 50 experts, a couple hundred experts. It's a killer book.
That's awesome.
But one of the doctors that she interviewed got really into acupuncture. He said it was because of 60s craziness. He just wanted to say fuck the man and just go to China and learn acupuncture he found that people were getting better like before he even did anything. Like he would have people come to his office and he wouldn't even really do anything and they would feel better. And I think he even experimented at some point with just not doing anything and just, oh, there you go. And they would just say that they were better. And he's like, man, does acupuncture work? Or I think that people can apply the placebo effect more to exotic treatments if they've chosen like, oh, none of the treatments around me work, but if I could just get my hands on something exotic, I know that would work.
Right.
And
Totally.
so the acupuncture, he's a doctor and he studied acupuncture. Like this is the guy.
Right. And if acupuncture were fake, which I don't believe it is, a more theatrical acupuncturist would be like more effectively using the placebo effect, probably.
Right.
Yeah.
I guess depending on the preference of the patient. Patient might like
That's true.
want a really calm person.
That's true.
But that was like the early days of hypnotism. That's what it was all about. It was all theatrics. It's like you have to wear the most ridiculous outfit and be extremely charismatic and flamboyant and confident. You need to be like halfway into a like God complex because you have to be like, oh, I am the magic man, and you have to do it like that because it would convince people to respect you. And now that wouldn't convince people to respect you. Like just like it used to be more effective to say, well, I'm a priest and this is what I'm telling you, and now it's I'm a doctor and this is what I'm telling you. Whoever has most authority can affect you the most with their words. And there's something that me and Brooke were talking about the other day because we've both gotten mental health diagnoses before and had the feeling that we were getting cursed when they told us. Like we had this feeling that they had taken something and stapled it on us and they were like, fuck, like we can't get it off because I do respect their authority a little bit. And so there was a lot of commentary in this book about how crazy town it is when you realize that a popular treatment is not effective, or you realize that a popular diagnosis is just made up, or you realize that a new, fresh treatment is extremely effective. If it's not an expensive medication, it takes forever to catch on. Yeah. And there was one study that she was describing in here. She's like, if this had been a study about an expensive pill, everyone in the world would have gotten it the next day. Like she's like talking about how crazy the results were. Yeah. With I think it was an example of hypnotism. So let me just run through some more examples. I have a lot to just fire off.
Sure.
So Pavlovian conditioning refers to
Pavlov's dog.
Yeah, exactly. Yeah. So you know the story. Pavlov gave these dogs food, but he would attach it to some alert that they were getting a food, ring a bell, shock them. I don't know why he had to shock them. He could have done anything. Even just walk in the room, they knew he's the food guy, and he noticed they would salivate, so he realized their physiological response is triggered by the awareness that they're going to get food, not the food itself. That's interesting. Yeah. So crazy example of Pavlovian conditioning. These rats were given sweetened water with a little bit of poison in it, enough to make them a little sick. Then they were given sweetened water. They'd never had sweetened water before, so they associated sweetened water just with those symptoms. Then they were given sweetened water with no poison, just sweetened water, repeatedly, and they died because they were so convinced that it was making them sick because they associated that taste with those symptoms.
Wow.
Oh, this was a really cool one. There's a study on kids on ADHD meds. They gave some of the kids just 2 months of meds. Some of them, they gave them a month of med and then dropped them off of meds completely. Some of them, they gave them meds for a month, and then they told them, we're going to now give you half of your normal meds and half of a placebo. We're just going to give you a pill, but it'll make you feel better, but there's nothing in it. And so we're just telling you.
So it's a placebo that they're acknowledging.
Yeah.
Okay.
Yeah.
All right.
She got it figured out. So it was, a placebo, just telling them this is a placebo. And these were kids, and they were like, cool, we'll just use our imaginations. And they did the best. That group did the best. They did better than the kids who consistently got the meds.
Wow.
The kids who were dropped off of their meds did do the worst, and then the kids who were kept on the meds did okay, and the kids who were given half placebo for the second half of the trial did the best. And I think, who was the first guy to do that kind of... Kapchuk, Kaptchuk. He was one of the pioneering research on honest placebos. You can go on Amazon now. You can buy all sorts of placebos, and you can take them. You just take it, you put an intention in it, and you swallow it, and it will help. And if you get certain colors, it'll affect different things. Like, what was it? I think for like calm feelings, you wanted green. I think for pain relief, for some reason, you wanted blue. I can't remember what all of them are, but certain colors will help you more. And there's been a ton of trials now on upfront placebos, and they still work. Just telling somebody that they can attach meaning to this, even though it doesn't inherently mean anything, that they can take it, they get better very consistently.
How weird.
Yeah.
Huh.
So it's like people have the capacity to will themselves to feel better, but they need a symbol to help them do it. And that really makes sense. Like humans really are like that. We really are symbolic creatures. And it's reminded me of the TM thing a lot because I've been practicing TM for like a year or so, and I think it's an incredibly effective tool. In TM, you're given a special mantra. I don't think personally that the mantra matters or means anything, but now that I've started using it, if I use another mantra, it doesn't work as well. Yeah. So I just keep the mantra. And I remember telling you a couple months ago, I figured that if I stopped using, I figured that this was a placebo effect, that they had convinced me through ritual to attach meaning to this word, and that I had then attached meaning to this word. But once I realized that the word didn't mean anything, then it would stop working. But I kept meditating and it still worked. So I figured maybe there is something special about the word. And now I'm going a third time. Maybe there's not something special about the word. Maybe even though I know it's just a word, I still associate a certain sensation with that word. And so it still has that effect on me. I'm going to try and fire off a couple more examples.
Cool.
Oh, man, this is a cool one. There was this researcher called, actually, I think the patient's name was Moret. Might have been a fake name. But she had lupus, and it's a drug that requires that she be medicated with immune system blockers because lupus involves the immune system harming the patient.
Okay.
And you can't give them too many. Like, if you give them too little, then it still attacks them. If you give them too much, then their immune system crashes. And so the biggest challenge with treating lupus is that you can't find just the right dosage to give them of their medication. So they went with the half approach. We're going to give you a lower dose, and we're going to give you a placebo with it. And what they did to increase its effectiveness is they attached a strange smell and a strange flavor to the placebo. No, here's what it was. They gave her the full medication, and they had her taste this stupid drink. They made up a flavor that would be nothing like she had ever tasted before. And note, this is why Sanskrit mantras are so effective with Americans. They gave her a strange flavor that was nothing like she had ever heard before or tasted before, and a strange smell. So she would taste this, smell this, and take the real medication. They had her do that a bunch. And then they switched the medication to a placebo but kept the smell and the flavor. And the effect remained because her brain associated those symptom changes and system changes with that taste and that smell. So then she could just use a placebo and drink the drink that had nothing in it.
God.
And so
this stuff is so wild. It's like the idea that this is like sort of mainstream accepted, that like placebo has this kind of power, is like not paid enough attention to. Like, this is weird as shit.
It's not. It doesn't have mainstream attention if you're talking about the medical system, because the medical system only respects medications that pass placebo-controlled double-blind trials. So that means that the only reason a medication can get respected is if it performs better than a placebo. So you can't really, like, that's an issue with testing hypnosis, because you can't hypnotize someone without informing them that they've been hypnotized. Like, you can't do it without them knowing that it happened.
Sure.
And so you can't do a double-blind trial on hypnosis. So doctors can just say, well, we don't have enough, there's no evidence, like, there's no double-blind trials.
Right.
Well, you can't do a double-blind trial on that. And so, like, what the medical system has done, I'm going to make the medical system sound like a demon, and this is not it's just a structure that's set up to make money. Systems, an object in motion will stay in motion. A system making bread is going to keep making its fucking bread. Yep. So how it does it, and this is no individual's fault, is it says the only treatment that's respected fits these criteria. And so, like, it's not like you can go up to them and say, well, hypnosis works better than those pills. And they go, yeah, but you have to you have to beat us at our game for us to respect your thing. It's like, well, you're the best at your game, but your game's not the best. It's
well,
like,
it doesn't say that in my book. Huh.
Right.
I didn't write that down.
Right.
But more so what I was referring to is actually just among the public. Like, how fucking weird is it that a placebo that, like, if you just believe that you can get better, sometimes that works.
Yeah.
And that is sort of mainstream accepted amongst most people that like, yeah, placebos work sometimes.
Yeah, most people do.
Yeah.
Oh, you're just saying generally even that the concept of placebos.
Yeah, the
not
idea that
this,
placebos,
not this information about placebos, but just like, yeah, because people say that's just a placebo effect. Like, just the placebos. Rewind.
That changes everything.
Right.
It changes everything about.
But here's the argument against what you're saying. The placebo effect does not treat patients. I'm a doctor. My job is not to convince patients that they're better. My job is to get patients better. So you can trick patients all you want. I'm going to treat them. That's the argument.
That it doesn't make people better, that it only makes people believe that they're better?
Yes. But the problem is that a lot of systems are so directly connected to the brain that the placebo actually cures them. And so the doctor that I'm pretending to be ignores that fact, though. So two of those systems are the immune system and the gastrointestinal system. They are so deeply interconnected to the brain. That's why Wim Hof was able to directly affect his immune system with his intention. He did a breathing exercise and cold training, and he was able to consciously control his immune system.
Right. They put E. coli into his body, and he was able to visually, on monitors, fight the infection and destroy it just by thinking about it.
Yeah.
Whereas anybody else, when they had it injected, that didn't work that way for them.
Right. Until they received his training, and then they all did great too.
And then everyone else can do it too.
Yeah. So he seems to have developed he says, well, basically, this is my own spitballing, but our temperature control system and our breathing system are almost always unconscious. And so when you take those systems and you bring them into the light of your conscious awareness, then you're able to reach further into your own mind-body system and have a greater impact on it. When you get in the cold water, it fucking sucks. Everything in your body wants to rebel against what you've chosen to do.
Yeah.
Your body wants to protect itself from cold so bad. When I take cold showers, my brain feels personally offended and attacked and hurt and vulnerable. I mean, it brings up all these feelings, like deep emotions that are just like, I'm being wronged. And it's like, because it's so self-protecting, it wants to say anything to convince me to just get out of the cold. Right. So if I say, no, we're staying in the cold, then eventually it just goes, all right, fine. And now you've gained conscious control over something that was previously unconscious. Same thing with breathing. Breathing exercises are so powerful because you're taking an unconscious system and bringing it into your consciousness. Breathing intentionally. This is something we've been only on Cure so far. We haven't touched Rewire Your Anxious Brain until now. This book talks about how to consciously activate your parasympathetic nervous system, which is the opposite of your sympathetic nervous system. So sympathetic nervous system is fight or flight. Parasympathetic is your rest and relaxation and recover instinct.
Okay.
So the best ways to consciously activate your parasympathetic nervous system are it's all yogi shit. It's all yoga, meditation, breathing, chanting. Those are the best ways that we know to consciously affect your own parasympathetic nervous system. And it wasn't known until... Actually, no, that's about the immune system. I was going to say it wasn't known until the 70s that your brain was so connected to your immune system. But yeah, anyway, we'll just frickin' jump back to that. So when it comes to the immune system, your brain can actually affect it. When it comes to your gut, your brain can actually affect it. So hypnosis and placebos can cure IBS, not just relieve the symptoms of IBS. It can make your digestive system work better, work differently. It's like you have employees working in your gut and you lost their phone number, and hypnosis and placebos can get you their phone number. You can call them and say, hey, I need you to do this and this, and they'll respond.
So there's some things in the body that do work with placebos better than others. Like your sort of willpower is stronger in healing some things than healing others.
Right. Like the bone thing, their bones are not actually getting stronger when they get the placebo. What was that fucking name? Vertebroplasty. Their bones are still weak, but they feel great, which is better. It might even be better than getting a dangerous and invasive operation. Yeah. But it's not curing the condition. And my assumption as a person who's studying consciousness is that the fact that there are some systems that are autonomic and some systems that are within our conscious control means that there's a spectrum from what's easy to control and what's harder to control.
Makes sense.
And that a person who had really mastered themselves could consciously control all of those systems. But I'm just taking what I'm seeing and bringing it to its logical extreme and going, well, every single thing in our body is connected to our consciousness, subconsciously or consciously. And so if you really mastered yourself, you would bring everything unconscious into your conscious awareness, and you could directly affect anything in your body you wanted to. But then we're getting into like Christian Science, like, you know, we're getting so far into the esoteric.
Yeah.
We just don't know yet. But so when it comes to physical performance, placebos can affect your physical performance because there is I think it's in our brain. It's something called the central governor. It's still theory at this point, I think. I don't think it's been located physically as an aspect of our brain, but it's understood that this function exists in our brain. It's the same thing as a limiter on the car that won't let you go over 113 miles an hour or wherever it's set on your car. You think that you exercise until your body can't go anymore and then it stops. But you stop way, way before that because the central governor is trying to protect your body from any potential damage. So your central governor is saying, no, we're going to save some energy. You stay down. You stay down. So if you give somebody a placebo, you've just convinced the central governor to release its grip a little bit. And that's part of the reason that sprinting alternated with walking is more effective than jogging because it contacts the central governor and it conditions the central governor to be comfortable letting your system turn up a little higher every time you do it. Because when you sprint, you go full effort. That's what sprinting is, full effort running. So the central governor goes, oh, I haven't worked that hard in a while. I didn't realize we could push it that hard. You go, yeah, we're good. And then if you keep doing that, the central governor will release a little control every single time.
Right.
You go, actually, yeah, we can
Raise
go
that
pretty
limit.
fucking hard.
When you prove that you can.
Yeah.
Okay.
And if you don't need to, it's like, I'm just going to keep you safe. Like, it's not necessary.
I heard David Goggins say once that most people think that they are absolutely gassed when they're actually at 40%. People think I have nothing left in me when they're at 40%. They haven't even started.
Right. So their central governor is like a helicopter mom.
Yeah.
And you have to just, hey, get the fuck out of here. Hypnosis. There's a chapter or two on hypnosis in this book, and people under hypnosis can change blood flow to different parts of their body. So you can put someone under hypnosis and tell them to put more blood in a certain area for medical benefit. So they did that for, what was it? I think it was related to IBS, why they did that. I'm not quite sure. Hypnosis is one of the most effective treatments known for IBS. You can hypnotize somebody and say, oh, look in your gut, you know, it looks like this. Now picture it doing this. And just through therapeutic imagery, you can get someone under hypnosis to cure their own IBS, and you can do it very quickly. It is the most effective method of treating IBS, and I mean, you have to do it correctly, but it's not rocket science. Like it's a completely accessible, affordable treatment.
Right.
It just doesn't make anybody all that much money.
Yeah.
Oh, you know what was cool is when I read Rewire Your Anxious Brain, it came up that your stomach gets upset when you're extremely anxious, and I was like, and I wrote down a question. I wrote down, why does your stomach get upset when you get anxious? And then it got answered in Cure, which is really cool. Though first of all, there's a bunch of connections between the brain and the gut, and in dangerous situations, we want to empty bowels to reduce blood flow to the gut so that we can reallocate that blood flow to the muscles that we need. So I was thinking, is it to decrease weight? Like you just want to get all waste out so that you're slightly lighter to flee? That doesn't really make sense because then you would be smelly and a predator would have an easier time getting you. It's like I couldn't figure it out, but
it reminds me, like when I take Jackson, one of my dogs, to the dog park, he'll poop 3 times within the first 30 minutes, which he would never have done if we weren't at the dog park. But he just like really unloads.
Weird.
Right then. And I've assumed it's just to make him like more agile or something like that. But maybe it is like there's a certain amount of blood flow or attention. Or
the tension, yeah. It takes blood flow to maintain the tension to stop the waste from coming out. So they're like, just get rid of it.
Right.
And then we can reallocate that blood flow somewhere else. We don't have that tension.
Totally.
Because you don't realize, it's not conscious, but you're just holding poop in.
Yeah.
You don't think about it. There was a study comparing hypnosis to psychotherapy to treat IBS. The patients selected for the psychotherapy group rated their symptoms 13. I don't remember it was out of what. Hypnosis, they happened to rate themselves 17. After hypnosis, I think it was a month of both. Or no, it was 2 months of hypnosis and psychotherapy. Psychotherapy, their reported symptoms went from 13 to 13. Hypnosis, it went from 17 to 1. 80% of those patients were still symptom-free after 5 years.
Wow.
That's crazy.
Yeah.
Okay, this is something really interesting too. There's this is getting away from the hypnosis subject, but still just talking broadly about the impact of the mind on your physical symptoms. There's some doctors that are getting into using virtual reality to distract people from painful operations. And so for burn victims, this is at UW here in Washington.
Mm-hmm.
They have this virtual reality world that they call Snow World, and they developed it specifically for burn victims. And the burn victims, when they're getting skin grafts, but they're on virtual reality in Snow World, they report way less discomfort, way less anxiety, and way less pain. So they just throw the goggles on them. It's audio and video, and then they just do the operation, and the people just notice it way less. It just distracts them away from it.
Wow, what a cool idea.
And then they added an element. They added induction scripts, which are hypnosis scripts. I guess we're not getting away from hypnosis. Hypnosis is the new Jordan Peterson. So they started adding hypnosis scripts to it. So you're feeling extremely relaxed, and all your tensions are going away, and then that improved their results even more.
So induction script meaning scripts
to induce hypnosis.
Okay, got it.
Yeah. So I don't know that there wasn't numbers on how many of the patients entered a hypnotic state through Snow World, but just the induction scripts playing in Snow World, it reduced their pain even more. So that's really cool.
For sure. Yeah, even just playing, I imagine any sort of ASMR in there at the same time would probably do it.
Yeah.
Would probably help.
Yeah. Well, ASMR is nothing like hypnosis. Hypnosis is hypnosis. Hypnosis is the best. No. Oh, this was a cool one. So there was this kind of little lesson in the book about how if you interpret stress and anxiety as a boost in energy or a boost in focus, it decreases your discomfort a lot more. Compared to if you consider it an interruption that you want to ignore. So they did a study where they induced stress by making people do public talks in front of extremely judgy panels of people. And the other one was they had people who were actually studying for the GRE, which is a college exam, to take a test. So not only were they taking a test, but they were a population that was particularly nervous about test taking because they were preparing for a big test. And the subjects who were told that, hey, when you get anxiety, the purpose of that anxiety or the purpose of that stress is to increase your system's level of awareness. So when you start to feel stressed, just realize that that's actually encouraging you to be more engaged in the activity that you're doing.
Right.
They experience significantly less stress. And then they followed those students in the GRE group, the test group, to the actual GRE, and they scored significantly better on the real exam in real life. So that's a really cool, just like general test-taking principle. Like we need to be teaching that to people more.
Yeah, that's a great way to look at anxiety, and I think we've probably discussed that before. But like, viewing
briefly,
it as an increase in your energy to make you better able to handle whatever it is that you're feeling anxious about right now. It's a reaction that is meant to help you, not to break you down. Although when you suddenly get a big influx of energy and you didn't expect it and didn't know what to do with it, you could just be shaking.
Yeah.
So yeah, if you own it in that way, that is a really cool idea.
I think it was from Stoic Toolkit. It was appreciate anxiety for calling your attention to the present moment. And
nice.
And there's also a connection here to just the general psychological concept of integration. Psychological integration, to ask how integrated are you is to ask what % of you is unified behind what you're up to. And so if your anxiety comes up and you want to avoid it, then you're not integrating your anxiety into what you're up to. But if your anxiety comes up and you go, oh yeah, I can use you too. Whoops. If you go, oh yeah, I can use you too, hop on. You're integrating your anxiety into your whole person.
Yeah.
Oh, they talked about palliative care, which is basically when somebody when it's pretty certain that somebody's going to die, they have like counselor type nurses whose whole purpose is just to talk to people about, hey, how are you going to tell your family? That's basically, hey, this is brand new to you. You've never been informed that you're going to die before.
Mhm.
I do this all the time. You know, can I help you deal with this? How are you going to tell so-and-so? What do you want to do before you die? Do you want to continue with treatment or just take your chances and just help them strategize about it? And they find that those people live a lot longer when they have palliative care. Like having somebody help them cope with the situation decreases their stress, and stress is really good for disease. So even saying, yeah, you're going to die, let's deal with that, can make you live longer. And there is another approach in here. This is really funny because this great physician, she invented this approach called comfort talk to help. It was people, I think, getting, is it an MRI or a CAT scan where you have to go through that ridiculous tube? You have to like go into a big tube, and it's like you can't have anything metal in the room.
I think it's an MRI, but I'm not sure. But I know the tube thing you're talking about.
Yeah, so she was helping people with those, and she found that if she talked with them in a specific kind of comforting way, it had really good results. And so she just wrote a protocol for being, for having extremely good bedside care, and gave it a name and branded it and started doing research on it so that she could say, hey, it'll save your hospital this much money. Because you can't just go to a hospital and say, hey, this protocol will improve your patient's experience. But you can go and you can say, hey, you know, when someone freaks out and you have to redo it and you end up losing money on here, if you use comfort talk protocol, you have fewer redos, you end up saving money. This is profitable. So that's the mission that she's on. She quit her practice and started a company and just started promoting this to hospitals full time and trying to figure out how to make it clear that it was profitable. I found that so funny because, like, you know, the overall theme of the talk that I did at TEDx was the behavioral health system has this set of values, right? They're trying to be more community-based. They're trying to be more culturally relevant. They're trying to be more youth and family voice and choice oriented. They have all these values.
I've never heard those terms.
Well, you should have watched my talk, dude. So, no, I don't think that one even came up. But it was culturally relevant, community-based, and something else. And it's basically, how can we make systems feel more like community? Because we don't want people to rely on systems. We want them to rely on community. And so in order to try to transition people from getting services from agencies to just relying on their own personal networks, they decided to incorporate these new values. And I found it really funny because people have a cousin or an uncle or a brother who's struggling, who's mentally ill or whatever, and they're like, we need professionals. And then the professionals are like, we need to be more like community. And so it's just so funny, these full circle moments. And this hospital one was one of those where the hospitals are going, what if we incorporated this novel new technology called comfort talk? And it's like, it's like you're having to reteach these science freaks that they need to act human with people. Right. It's like, it's so...
What if we expressed an emotion?
Yeah, I just hear Tim Dillon, this is autistic sexless horror culture.
Oh, no.
Yes, this autistic sexless horror culture. And I'm like, that's really what hospitals are like. You know, they are like these creepy robotic people.
Cold. There's machines pumping lungs for people.
Yeah. And then when you have someone who's like really, really sincere in a hospital setting, it stands out. And you're like, you're amazing. Right. But it's not really the norm. And so, God, that's comical. Like, well, we need to take them to the professionals. But the professionals are just now learning about compassion. Like, I mean, relearning.
Relearning, yeah.
But it's so funny how that pendulum swings back and forth.
Yeah.
All I wrote down with the 2 arrows thing was pain has 2 arrows. That's why I butchered it. That's all I wrote down.
Well, we got there.
So one more little point from this book is that they did a chapter on mindfulness near the end, and they had already covered the stuff about VR and hypnosis being used to distract people from pain. But when they started looking into mindfulness and what it is as a psychotechnology, the purpose of, like, the mindful approach to pain is look the pain directly in the eyes, like embrace the pain completely, and it'll dissipate because you realize when you give it your full attention that most of the pain coming from the pain was the emotional ideas that you attach to it, not the physical sensation. So when you're mindful of it and you see it clearly and accurately, you realize that it's only 20% as painful as it is, and you realize that you're courageous enough to face it, so you have a way different experience of it. And it's funny because it's the same approach as the distraction thing, because, well, it's based on the same truth that most of the pain is psychological, not physical, but it has the opposite way of addressing it. It's like most of the pain is psychological, not physical. So if you look away, it won't hurt that bad. But also, most of the pain is psychological, not physical. So if you look directly at it, it won't hurt as bad.
Right.
Either way, distract yourself from it or look directly at it. But if you look to the side, it seems to really just fuck you up.
Right. Looking at it at the corner of your eyes.
Yeah.
Don't do that.
Yeah. It seems like that's the only wrong way to approach pain. Like, just take your mind off of it or put your mind directly on it. Run, like, it's like fight or flee, you know?
Which reminds me a lot of what we talked about with Eckhart Tolle. And he had said, like, if you're feeling lazy, if you're feeling like you're not sure if you want to get something done or not, like, you got to pick. Like, you have to pick. Either if you feel like there's something you should be doing, get up right now and go do it. Or don't and be very lazy, but just accept that you're not doing it. But you can't be in between. You got to pick one or the other.
Right.
Yeah.
And I think part of his point was if you go the lazy route, you won't do it for that long. Because if you're mindfully, intentionally lazy, then you're not lazy, you're resting. And you don't need infinite rest.
Right.
So if you mindfully rest, you'll eventually go, I'm rested now, thank you. And you'll get up and do something without much effort.
Right. And the rest of that snippet was, if you go deeply into laziness and to just enjoying that, you're soon going to come out of it.
Yeah.
Or you won't. And that's okay too. Like, cut to another sentence. Or you won't, and that's fine too.
That's funny. I feel like he had to add that caveat because if you rest only for the purpose of being productive when you're done resting, you're not fully resting. But if you accept that the rest may never end, you will actually rest, and then it will. You kind of have to trick yourself.
Oh, interesting.
Like a reverse, almost like a reverse psychology thing.
Totally. Yeah.
All right, so let's fuck with this other book for a minute.
Okay.
This book really emphasized the difference between amygdala and cortex anxiety that manifests in the cortex and anxiety that manifests in the amygdala. And I word it that way because neuroscientists, which this book is, one of them was a neuroscientist, one of them I think was a librarian. I don't know.
Okay.
A clinical psychologist and a collection management supervisor at a library in a college. So yeah,
sounds like a librarian.
Yeah, that's funny. I don't know why
like
exactly that.
Way to say librarian.
Yeah, collection management supervisor. That's like a waste management specialist, huh?
That means they get the books out of the book drop.
I'm a maintenance technician.
Yeah.
And then Pittman is a clinical psychologist specializing in the treatment of brain injuries and anxiety disorders, and is a professor at the same university. So they're probably friends from Notre Dame. Okay. So cool. So but neuroscientists and clinical psychologists tend to say that the anxiety comes from the amygdala or comes from the cortex. And that always just strikes me as kind of a bozo way to look at it, because it's not like the amygdala invents anxiety. It's that you experience that.
Could you tell me a little bit about both of those things?
Yeah,
I'm sure I've heard it before, but it's not fresh.
Yeah, I barely mentioned it before. So cortex anxiety is overthinking. Amygdala anxiety is overfeeling. Cortex is more conscious. Amygdala is more unconscious.
Okay.
So if you imagine something shitty happening in the future and you get anxious about it, that's cortex anxiety. Mm-hmm. If you experience something that triggers you into having an immense amount of anxiety immediately, that's amygdala anxiety.
Okay.
The cortex is a rational guy that's looking around trying to figure things out. But there's this third guy called the hippocampus who he gets new sensory information, then he decides where it needs to go. So if it's something that needs to be considered and thought about, he tosses it to the cortex, underhand. If it's something that's urgent, he throws it. No, it wasn't a reference to that at all. He throws it overhand as hard as he can to the amygdala, because like the distance, the time that it takes for the hippocampus to get a message to the amygdala versus the cortex is way different. Because the amygdala's function is, there's an emergency going on, everybody get the fuck out of the way, I got this. Mm-hmm. Everybody else shuts down and the amygdala takes over. That's a panic attack. So you've experienced something that reminds you of an extreme amount of panic. Mm-hmm. Your hippocampus chucks it 100 miles an hour. The amygdala catches it and just pulls red flags. Everything goes up. Heart rate up, blood pressure up, everything up. We're preparing for war. But you're just sitting in your bedroom and you read something on the internet, you know, but your amygdala doesn't know. So your amygdala is like the emergency service. It's like police, ambulance, fire.
Okay.
Once the amygdala is activated, the cortex can't contact it. The amygdala has to be calmed before any thinking can happen. So we talked in probably the Hillary Hendel It's Not Always Depression episode. We talked about how if you're supporting, I use the example, if Sarah asked you, should I be anxious about this? Then you don't have to validate that because it's an anxious thought. So you could say, no, fuck no, you shouldn't be anxious. You're fully prepared for this. You got it. And you can reason. But if she says, I'm extremely anxious, like I'm losing it, and you say, you shouldn't be anxious. Now you're not correcting a wrong thought. You're invalidating an emotion. So you have to pay attention if you're supporting somebody. Are they in cortex anxiety or are they in amygdala anxiety?
Okay.
Once they're in amygdala anxiety, the only thing that you can do is ride it out. It's like a wave has come. You just have to ride that wave until it dissipates. There's no thinking. There's no nothing. You can breathe. You can do grounding exercises. I can see 5 things, smell 4 things, taste 1 thing, whatever. You can do belly breathing. You can refer to a chant or a mantra, especially if you've programmed that chant or mantra to be calming to you previously. You can do fidget exercises. Pretty much all you have is coping skills. The cortex can't do shit. So anyway, they say when anxiety comes from the cortex or comes from the amygdala, but it doesn't come from there. It's that you've had an experience and you have a whole team of sub-personalities in your brain that are equipped for different experiences. And problems arise, like persistent anxiety occurs when you have the wrong employees being dispatched for certain experiences. So, like, it's kind of just like if you call the police on people when you should have called a therapist, you know, like you should have called a counselor and someone's having a mental breakdown and you call the police and they don't know what to do. It's like, that's what's happening when your amygdala responds to something that doesn't need to be as big of a deal as the amygdala wants to make it.
Right.
And something that Cure covered that this book didn't, which I feel like I'm like, oh, I wish I could take that out and put it in this book. That went in here. The amygdala is capable of growing 3 times larger. Like the amygdala can triple just based on excessive use. So your brain can become a police state, just like civilizations can, where it's like, oh, there's fucking police on every block. Nobody can do anything anymore. And anytime anything happens, everyone calls the police, but everybody hates the fucking police anyway. Your brain can become that by excessively stimulating the amygdala. And so one of the most common ways to deal with that is exposure therapy. So what exposure therapy is you're taking the stimulus, the experience that normally activates the amygdala, and you're approaching it voluntarily to create new associations to that experience so that you can start tossing those balls to the cortex instead of the amygdala. So the next time, like if you see a spider and you just immediately freak out, it's not like you're like, oh, a spider, I should freak out. That you have experiences, whether in this life or past, that spiders are really, really fucking dangerous. That's either just biologically programmed into you or something in your own life. And so when you see a spider, your amygdala is like, I'm supposed to freak out about this. Give me the reins. I'm turning around and running or whatever. And when you approach it over time repeatedly, your brain learns, okay, no, this experience doesn't necessarily mean danger. We can just give this to the cortex and we can just be rational about this. And exposure therapy you can do it even more rapidly with hypnosis. They call it circle therapy, that you place something that you're afraid of or that you need to deal with in a circle. And this is all an internal experience. This is all therapeutic imagery.
Oh, okay.
Then you can, in your imagination, approach that circle. You can go into it voluntarily. You can step out of it voluntarily. And since it's just an internal experience, you feel safer because it's not real. It's inside. But your brain still reprograms like it's having that experience. So you can do exposure therapy just with your imagination, which I think is really encouraging, because if you're afraid of something, start just by picturing it. Can you picture it without freaking out? That's the start. And if you can picture it without freaking out, then can you vividly imagine engaging with it without freaking out? And once you get to that point, like, okay, now can you approach it physically without freaking out?
Mm-hmm.
And so even non-hypnotist therapists will start there. Like, can you bring up a picture of it in your mind? No, I can't even think about it. Okay. Can you write the word on a piece of paper without picturing it? Like, even with your imagination, how close can you get to it?
Right.
You can tell me that you're afraid of it. You can start there. So you can do something,
right,
but nothing more. Okay, then let's just stop there for now. Okay, and then, well, what if we had a fake one and it was on the other side of the room? Or, you have to start anywhere. And you have to condition people like you're conditioning a 2-year-old, because that's how that part of the brain acts. That's how it acts. Like, it's like a 2-year-old just ready to flip out. So you can't go, come on, it's not real. No, you can say, come on, it's not real to the cortex. You cannot say that to the amygdala. You cannot condition it with reasoning. You're speaking Spanish to someone who speaks Italian. It just doesn't compute that way.
Yeah.
So, fun fact about cortex anxiety is creative people have more cortex anxiety because they have a better imagination, so they have an easier time generating reasons to be anxious.
That's interesting. Okay.
Yeah. Oh, I'm sorry. It's the thalamus. What did I say? Hippocampus?
Hippocampus is like the mediator.
That's the thalamus. I had that completely wrong.
Okay.
Hippocampus is something else. These authors think that cortex-focused therapy is a lot more common. A lot more therapy focuses on changing your thinking than really addressing the emotional reactions. Another fun fact about this is some anti-anxiety medications, what they do is they just block those synapses. Like when that ball gets thrown, they just block it. So that's why they get on like an anti-anxiety medication. They're like, I can't feel anything. It's like, oh yeah, we just stopped paying the amygdala's phone bill. we just fucking like what some of those pills do is they have the ability to block certain neural synapses. So they can see that's where the thalamus sends the message to the amygdala right there. If we can just cut that or drastically reduce it, then the panic attack will go away. It's like, ugh.
Oh, so you're saying
technically,
when you cut that connection, it does make the panic attack go away, but it also makes a lot of other stuff that you would like not to go away.
And it also
feelings.
Yeah, and it's like in a pinch that'll get you by. It's not going to kill you, but the overall goal is to integrate as a human being, and that's not getting you there at all. So it's like that needs to be an emergency. That's just like if this person has panic attacks like this, they're going to die. We need to just cut that cord for now and figure out the rest later. But by no means a solution. I think it's the stupidest idea I've ever heard.
It doesn't sound great.
But I don't think that's all anti-anxiety medications, but I'll be reading more about that soon. I was kind of curious as I was reading this. The author said that humans aren't generally aware of the activity of the amygdala. And that made me so curious because the amygdala is kind of, so first of all, when authors write books like this that are for an everyday Western lay audience, and they say people generally, they're always talking about weird people. Weird people, this is an acronym, WEIRD. It's something that I learned about in, I think it was Jonathan Haidt's, one of his books. It's Western, educated, industrialized, something, and democratic. It's like a way of summarizing like...
This was used actually a lot in Hunter-Gatherer's Guide.
Perfect.
I didn't even... I don't think
you covered it.
Used the term because I didn't really like it. I thought like that's a dumb acronym.
No, I really like it because it you read a book like this and they go, most people are not aware of the amygdala, and I'm like, are we talking about like the humans, the species, or are we talking like people from around here? And I'm like, I think we're talking just about weird people, and so this is kind of far fetched, but I'm just thinking about like the amygdala and the cortex. To me, they sound like a yin and yang relationship. Like the amygdala sounds more yin and the cortex sounds more yang.
Yeah, I agree.
And weird people are really yangy. Weird people are yangy as hell. So weird people are concrete.
Oh, yes, I agree.
They're cognitive. And so I'm just wondering, are we just out of touch with our amygdala? Like, is this the human condition? Is we're out of touch with our amygdala? That just doesn't register right to me, because if we, I mean, the more conscious of ourselves we become, like the more subpersonalities in ourselves we have awareness of, the better control we have over our own experiences. And extremely experienced monks, this is something that was covered in Cure, to jump back over here, can consciously, on command, turn their blood pressure and heart rate up and down, or affect their digestive system. You know, even the fucking magician from over here, Chris.
No.
Not Chris Angel?
I don't think it was Chris Angel. David Blaine.
David Blaine. Yeah. He's conditioned himself to do things like that.
Yeah, he can do weird stuff.
That we as humans know of the psychotechnologies to gain control over systems that the hospitals and weird people say are unconscious systems. So it just struck me as bullshit when they're like, the amygdala is mostly unconscious. Most people are unconscious of the amygdalas. These are a subconscious system. I'm like, well, it's in our dark, but it's not in the dark. There's not the dark. You know, like, we're so out of touch with ourselves that we're like, oh yeah, I'm extremely anxious. I don't know why. Whereas, like, people who have a better awareness of their whole system can just easily ask their systems, like, oh, why are you freaking out? And they're like,
right, yeah.
Oh, well, let me tell you. And so it just, this book was like a really good source of a bunch of little tidbits, but I didn't feel like these authors really had any grasp on a holistic solution to the problem of anxiety. Because it's like, well, what does it even mean that our amygdalas are unconscious? Because that makes me think we need to develop and mature our consciousness to the point that our brain doesn't just go do shit without us having any idea what it's doing. It's like when someone runs a restaurant and you could tell them like, oh, do you know your servers are drunk? You know, and they're like, fuck, really? It's like, are you running this place? Like, that's how people are when they're like, yeah, my amygdala, you know, just goes out and does shit. I don't know. It's like, well, then you're not paying attention. You're not managing your own system. You're not calling everybody who works for you and checking in on them. You're not dropping by. You're not having team meetings, which is kind of what meditation is. Like, let's bring everybody in a quiet circle together and be together and become more cohesive and integrated. So I feel like the answer is to make unconscious systems more conscious, become more mindful of the present moment, and gain the ability to contact the aspect of yourself that truly supervises the whole system of subpersonalities. Because when you're acting from that place, you have control of yourself. And when you're not acting from that place, you don't. It's just like let's say you call Amazon, right? You say, I want a refund. Like, I can't refund this one. Let me talk to your manager. You get to the manager, they go, fuck it, here's the refund. Yeah. You just got to a higher point that has more control over the system. Yeah. So if you say, oh, part of me is unconscious and part of me is conscious, it's like someone saying, sorry, sir, there's nothing I can do. Yeah, there's nothing you can do. That's why I'm done fucking talking to you. Yeah. So if you think part of your system is conscious and part of it's unconscious, like, well, then escalate. Then close your eyes.
Escalate.
And just go up. And you have to go in to go up, you know, but the closer you are to the part of you that is the capital S self that really controls the whole system, the more is conscious. That's the solution as far as I'm concerned. You can and you can do that externally by making a practice of being more aware of the present moment, or you can do that internally by making it a practice to sit down and experience pure silent consciousness, the thing at your core that's unshakable. Either of those things will allow you to escalate to a part of yourself that's in greater control of your system. And I don't feel like this book really had solutions. It was like, here's all these different takes on anxiety and all these different approaches to anxiety. It's like, none of these are it. None of these are it. So that's just my own freaking commentary, though. And then I wrote, doctor, shaking hand, pin.
Wow, that's really interesting.
I bet that was good.
That's insightful.
Fun fact, public speaking is so terrifying because you feel like you're going to be rejected by your peers, and evolutionarily, when you were rejected by your peers, you were in the jungle alone and you were going to get eaten by a tiger. So whenever you feel judged by a group, it activates a deep instinct in you that when you're judged by a group, it could easily mean your certain death. Isn't that interesting?
Yeah, that's an interesting angle.
Whenever you feel a group is rejecting you and and your anxiety just spikes, just remind yourself.
Exiled?
Yeah, exile. I didn't know the word. Yeah, that's exactly what it is. It's exile trauma.
Yeah, okay.
Generational exile trauma.
Interesting.
So we should be very conscious of that. The book does point out that your amygdala can be explored by asking your mind what your extreme emotional responses remind you of from the past. And that's a tip that's very similar to Hilary Hendel's approach. Because she said, in It's Not Always Depression, we talked about the change triangle, becoming calm, curious, confident, whatever the other ones. So in that book, she said, where you want to start with dealing with your anxiety, depression, whatever it is first you want to ask your body, what does this remind me of? Because then you can connect back to what's actually triggering the emotion that you're having. And this book says the exact same thing, which is kind of cool. The first thing you want to ask about your anxiety is, what does this anxiety remind me of? Because you say, I'm anxious right now and I don't know why. And that's like, where do you start? Like, well, it's about asking the right questions to start. The right question is, what does this remind you of deep down? And it's best to do that with yourself, because I find a lot of the time if you do that with someone else, they'll go, I just don't know. Well, they just don't want to tell you, you know? So, but with yourself, it's pretty effective. What does this anxiety remind you of? And you'll probably remember something.
Yeah, totally. Like it just reminded me of a thing that happened. I don't want to go into the details, but like,
nobody ever wants to share stuff like that.
I mean, a couple months ago, like Sarah did something that upset me that wasn't a big deal, really, but I got really upset about it, and she was sorry, but I was like, I'm like, I don't accept it, and like I had no good reason to, so I went off and like, as soon as I like closed my eyes to meditate on it, I remembered something that happened when I was like 12, and like, I'm just pissed about. I just remembered, I was blaming her on what Mom did, what Mom did. Yeah.
Right.
Yeah.
Right. So the reason that we have our system set up like that is that if you come across a predator and you respond in a certain way, then you save data on that response and you save it as a protocol. And then the next time you're exposed to the same danger, you go, all right, I already have data saved on this. Run protocol, I see a saber-toothed tiger. And then you can rely on your instincts. And so every time you face that danger, you can run that same protocol. And each time you can adjust the protocol a little bit, but you need a protocol to start with. Because if every single time we faced danger throughout our evolutionary history, we stopped and thought about it, we wouldn't have gotten anywhere. And so that's why we have that system. So then Sarah does something and your brain goes, would you like me to run protocol? Mom won't go outside to smoke. She's standing in the door and you're mad. And then without you even realizing, you run that protocol and now you're as mad as you were in that system or in that situation. But that's why we make those connections, just to try to expedite and make more efficient the process of protecting ourselves from danger. And now we have to go meta. No, we're not just changing protocols now. We're changing the protocol of how we make protocols, because that doesn't work anymore. Every situation is different, and almost none of them are dangerous, and almost everyone requires rational, considerate thought. There's almost no problem anymore that we can solve by knee-jerk amygdala reactions. That doesn't work. I mean, there's the one-off, you're about to get hit by a car and you jump out of the way before you think about it, because your thalamus is smart enough to go, oh, that's a car, I'm going to shoot that to the amygdala. And the amygdala has everybody's phone number. The amygdala can make your body do fucking anything.
Right.
If the amygdala says we're doing this right now, nobody even has the reaction time. Nobody, as in none of your subpersonalities, even has the reaction time to say, actually, what if we did this? The amygdala is given that
this override power.
Exactly. Override key.
It's like giving emergency powers to a leader.
Emergency executive powers. Yeah.
Totally.
Exactly. So they go, nope, sorry, we're on what do you call it when a state of emergency? We're in
martial law.
Martial law. Yeah. Sorry, we're on martial law for this 1 second. We're getting the fuck out of the way of this car. You don't even remember what happened, because the mechanism that you call remembering is way too slow to have had anything to do with what just happened.
Right. And that also has the ability to also override all limiters, I imagine. All limiters that you mentally impose on yourself. Which is maybe why some the stories of a mother who can lift a car off of her kid in a moment where it needs to happen. It just doesn't matter. Every limiter off. We're doing this.
Right.
Yeah.
That's really interesting. I remember Rogan saying that when he exercises, he has extremely dramatic imagery that he uses to push his exercise. One of them is he thinks about slaughtering pedophiles.
Did he say that?
Yeah.
I don't remember that
to
one.
get himself to work out harder.
Yeah.
Because you can convince your brain. I mean, just like our niece one time, she was like wrongfully like entrapped in a guy's house. Like,
God, that was crazy.
yeah, like her and a friend were throwing rocks. They were being annoying kids, throwing rocks at somebody's house or something, and this guy snatched him up and grabbed him and pulled him inside. And
That's like apparently a citizen's arrest.
Yeah, he
Out
was
of
some
his
kind of
mind.
kook who thought like, oh, I'm gonna restore order or whatever. Some old fucking conservative dork. And the one of the kids got away, ran home, got their dad. The dad was like a foot shorter than this guy, and the guy knocked on the door, and the guy answered, and he just hit him once and just knocked him out cold. And that's an example of like there's a part of you that's above the, what do you call it? What was the part of the brain that's the limiter valve? Governor. That it goes, nope, sorry. There's obviously something above the governor that can govern the governor that says,
Sure, yeah.
fuck you. Like your very soul or something, It's just like, tell the governor. It's like 5 steps of escalation up where it's like, no, it's not a CSA. It's not a shift lead. It's not a manager. It's not a site manager. Someone called from corporate and they fucking handled it.
Yeah.
And it's, it's really comforting to know that you have that whole hierarchy about you.
Yeah. I also don't think it's out of the question that there is a governor high enough that can go, okay, the rules of how a body works don't even count right now.
Right.
There might be.
Right.
Yeah.
There's stories of that in the New Testament that people basically they refused to sin, they refused to strike back against people, they refused to fight. They just submitted to all authority, they told the truth, and then just miraculous things would just happen along the way. Like they'd be in court and they would all of a sudden just give an eloquent speech with a bunch of information perfectly tied together that they didn't even know.
Mm-hmm.
Or they'd be in a cell and they would just walk through the wall and they would just walk away. Like there's all these stories about people were so, and there's this connection there. So what Christ is theoretically is that hierarchy that we're talking about. He's the thing that's at the top of all of those hierarchies of hierarchies. But he is that embodied. So there's nothing. And this is all hypothetical. I'm not saying this is like some truth anybody should accept, but the story goes that he's the peak of all of those hierarchies embodied. So there's no physical or mental laws that apply to him absolutely, because laws are really, if this universe is creative and intelligent, then laws are more like guidelines or habits that the living being of the universe has. That if there's a creative intelligence at the top of this universe, then it has free will and it can choose to bypass laws when it wants to.
Right.
And so those people in the New Testament, they refused to act except in the spirit of Christ because that was their theory. Mm-hmm. No, we answer directly to the boss, the boss, the boss, the boss, the boss, the boss, the boss. And so it's like we're here working directly for Bezos as Amazon employees. And so you can disagree with us, you can talk shit to us, whatever. But at the end of the day, Bezos is just, he's going to bail us out every single time if it's an Amazon matter because he's the guy.
Yeah.
And so that was a theory. It's like,
this is just a I think it kind of an interesting anecdote that a lot of people don't know that pertains to that. What Bezos does, like, because people will email, like you can email him at jeff@amazon.com. You can email him directly, and sometimes he looks at it, sometimes he has an assistant look at it. But if there's something that actually does pique his interest, he will forward it to a specific team called the Executive Customer Relations with literally just a question mark. He won't even bother typing anything more than that. But he'll just say, like, question mark, and then it becomes like that is more important than anything else going on. Is like there's a Jeff Bezos question mark email we need to deal with. And then that takes priority over whatever else you're working on.
Wow.
That's how he does it.
That's really cool.
Yeah.
So, yeah, the Christian theory is really similar to that. It's like, no, there's certain things that God chooses to just intervene on. That whatever creative intelligence is at the top of this strange evolutionary hierarchy of creative intelligences that we live in, whatever it is, It has a set of laws. Normally, it just lets them play out, but sometimes it freely chooses to override them and just do something wild.
Yeah.
That's why Narnia represents God as a lion. It's good, but it's not tame.
Aslan.
The amygdala is what initiates the fight, flight, freeze. We've pretty much covered that.
Mm-hmm.
Responding to amygdala anxiety, deep breathing, muscle relaxation. If you're in fight mode, you can exercise. There was one kid that was quoted in this. They were given an exercise from their counselor. If you feel extremely anxious in the family reunion, go for a jog. So they went for a jog. The family reunion started happening. They felt super anxious. They went for a jog. And when they got back from the jog, they were able to interact with everybody just fine. And so their counselor asked them, like, why? And they said, I tricked my amygdala into thinking that I escaped the threat it perceived. It's like, oh, you got away. We're good now.
Interesting.
That's so comical.
Yeah.
So, I mean, either fight or flight. If you're in freeze, you're not going to be able to exercise. You're just going to have to breathe through it and just exist. Just continue to exist. It's not going to last forever.
Yeah.
But if you're in fight or flight,
Mhm.
you can exercise, and it'll let the tension out of your system. That's pretty cool.
It just reminded me of a thing that singer Jewel said on Joe Rogan's podcast that I almost said earlier. But there was a story at like a very low point in her life. She found herself like on the beach watching the ocean and considering killing herself and just thinking about how horrible life was. And then she said she had a realization that nothing stays the same. Like she's just watching the ocean and thinking about how ever changing it is, and how ridiculous is it that I think I'm the only thing that will never change and that I'll always feel this shitty. So I just need to wait it out, and just you can wait through anything. Eventually you will be different than you are now. You can just wait.
Yeah,
And just be. Yeah.
That's
I
one
liked
of the core principles of Buddhism is the law of impermanence.
Right.
Like that they consider
Okay.
there's something to be fundamentally enlightening about that principle. If you can truly embody, digest, I can't think of the word. If you can truly accept, there's some word I can't remember, but if you can truly get the principle that nothing lasts forever, it'll really, really change your experience.
Right.
And that
'Cause
to me
also
sounds
makes
kind
you
of
let go
silly
of
because I'm
you.
like, of course I know. Of course I know that.
Right.
But no, I don't. No, I
not
don't.
really.
I don't
No.
really know that everything is always changing, and it always will.
Right.
It's just wild.
People very much are attached to themselves or their personality traits or their
Very true.
things.
Very
like,
true.
Even that, yeah, if you accept nothing is permanent, that it means that every aspect of your personality will not exist soon. Like it will change.
Oh, I never thought about that. 'Cause
Yeah.
we talked in I think it was like 2 and 3 episodes ago. We talked about how important it is to accept the fact that you and everything you know and love and value is all going to go away. Like
Yeah.
one day, this whole universe is going to go through a reset.
Yeah.
Black holes are going to swallow every single thing that we know, and there's nothing we can or should do about it. And that results in a similar realization. Like that's because the law of impermanence says not that everything will cease to exist, but at least that everything will change so fundamentally that it won't be recognizable anymore.
Yeah, totally.
And we don't really think like that. We do kind of just cling to things like they're always going to be there.
Yeah.
And just like we cry when things go away, or we keep things in our house that we'll never use again just
Right.
because, well, that's my thing.
Yeah, change is very upsetting.
Yeah, it is. It
But
is.
it's
It's upsetting
the
because
only
it
thing there
reminds
is.
us that we're not, that whatever we identify with isn't real.
Right.
Like, because if we are that which is comfortable with the fact that everything's changing, then we are the unchanging. Like, we are pure consciousness. We are the
I
infinite.
like that.
We
Yeah.
are the only thing.
Right.
If you accept that everything's ever changing, you've become the only thing that never will change, which is Tao, God, pure consciousness, blah, 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 blah,
Yeah.
blah, blah.
Yeah. The thing that observes.
Yeah, the observer. Yeah. Capital O. So I said deep breathing, muscle relaxation, exercise if in fight mode. If in flee or freeze mode, try to do something calming anyway, like go for a walk so that the brain doesn't get trained to continue freezing or fleeing when under stress. Yeah, you want to train the body out of freezing. So if it freezes, you want to try to get it to do something. Just channel amygdala anxiety into some kind of movement. Stuff that activates parasympathetic nervous system, meditation, yoga, chanting, deep and purposeful breathing, intentional breathing. During panic attacks, hyperventilation can occur. And a panic attack, of course, is just the amygdala overreacting to a situation so much that it totally debilitates you from doing anything and makes you feel like you're going to die. Makes you feel like your heart is going to beat so hard that you die.
Mm-hmm.
And hyperventilation can occur. And so you can do the paper bag thing. Shallow breathing occurs because of hyperventilation, which results in a shortage of carbon dioxide, which can be replaced by breathing into a paper bag. So the shallow breathing means you're not getting enough carbon dioxide. So if you just breathe out carbon dioxide in, I got really close to the mic, and then breathe it back in, you can reverse that. So that's one of the only tricks you got.
Okay. I've never really thought about like how that functioned, why people did that. That's interesting.
Yeah.
Yeah.
This book also mentioned that deep breathing, part of the benefit is that it massages the stomach and liver and kidneys. And I just learned that at MIU too, like last week, because I'm in a yoga class right now at MIU. And, dude, fucking random side note, MIU just dropped a new bachelor's degree today.
What is it?
It's wellness and life coaching. So you get a life coaching certification.
Someone has authority over that? Over life
Yeah,
coach?
International Coaching Federation. Yeah,
It sounds like a made-up job.
No.
It sounds like anything anyone could do.
Anybody could do life coaching. Well, you just don't know what life coaching is. It's a specific approach. Like it's different than counseling. It's like a very, because I've taken one coaching class before, just like a few days. Coaching is a particular approach to helping somebody by talking to them. It's very non-directive. It's really about like figuring out their goals, and then there's a lot of mirroring, a lot of like listening, a lot of motivational interviewing. Like, you tell me your goals, and then I'll ask you the right questions until I can help you sort out what's stopping you from getting those goals and help you rethink your approach to those goals.
Okay. So the term life coach is more meaningful than the term advice giver.
Do not give advice as a life coach.
Okay.
All right. No, you would never give advice.
I imagined it to be.
Yeah. No, that would be like a mentor. Like a mentor, you would give advice. Like, you respect the way that I live life, so you want me to teach you how to do life so you can do life more the way I do. So I'm going to tell you that that's like a friend or a mentor. A life coach is like, I'm going to figure out exactly what your goal is, what your strengths are, what prevents you from getting those goals, and try to help you connect the dots so that you can get to those goals more easily. That's the coach approach. But the life and wellness coaching, it incorporates Ayurveda wellness stuff,
right,
with life coaching classes, so that you can coach people in which I don't really get, because then you would be getting pretty directive, right? Like, why do you need to be trained in a specific health system? I guess a wellness coach would be a little more directive than a life coach, because you could tell somebody information about how to live healthier.
Yeah.
But don't people really strongly disagree about the healthiest way to live life?
Oh, yeah.
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 So, I don't know. Anyway, pretty interesting, though. You already know I'm going to be Googling that shit.
Yeah.
Oh, I'm going to be Googling that degree. But yeah, deep breathing massages your stomach, liver, and heart. Interesting.
Huh.
But yeah, try that sometime. Like, but that's deep breathing from the belly specifically.
Right. Yeah, and that was talked about in the book about public speaking, Dale Carnegie's book about public speaking.
Really?
And they didn't say that, but they just expressed that, like, you should always be trying to breathe through your diaphragm, that you're going to get more power that way, and that I think they even said it was like healthier on some level, but they didn't go that deep into it. No.
About the massaging thing.
But it pretty much sounded like they thought you should always be trying to breathe with your diaphragm, which I don't even get what that is, but move your belly.
What the diaphragm is?
Yeah.
Well, I understand that. Yeah, I don't quite either. Cause
is it a belly lung? Where is it?
The diaphragm is the muscle that you breathe with. The lungs are not a muscle. The lungs are a sac that the diaphragm pushes air into and out of.
Okay.
And so breathing with the diaphragm is more intentional, because you're breathing directly with the mechanism that actually performs the action, rather than doing it indirectly to the balloons that the diaphragm fills up. So, but I don't understand. what if the diaphragm is the muscle that breathes? How can you breathe with your lungs? Your lungs don't even.
Maybe it's be conscious of the fact that the diaphragm is the thing that's doing it. And if you're conscious of that, then you can maybe allow more space and push harder with your diaphragm to get the air out of you.
Oh, yeah. Maybe if you breathe with your lungs, you're just breathing with the top part of your lung. Because I know there is a difference between breathing air just into the top of your lungs and breathing air into your whole lungs. So maybe that's it, the belly breathing. Because I think the lungs are lower than we tend to think. We tend to think that they're like way up here in our upper chest, but I think they're actually like lower behind our.
Yeah, I have thought they're all like in the rib cage.
But they're below the rib cage mostly, right?
I don't know. That is what I think up until this moment.
Thank God we have a podcast.
Yeah.
Thank God we can tell people how shit really works. Oh, this book also presented evidence that mindfulness lessens the amygdala's reactions to negative statements. So they used, they did a control group that didn't get mindfulness training, a group that got mindfulness training, and then they just had them read statements that were negative. They weren't insults directed towards the person, just reading negative phrases. And they noticed that the brains without the mindfulness training had greater responses to that negativity. And the people with mindfulness training had a more just unbiased observation of like, oh, that's negative, but not like, oh, that's negative. Like, oh, it's negative. It's out there.
Right.
They identify with it less. Oh, it also, this book offered the general advice that if you want to start making yourself less anxious in general, you should start by addressing anxieties that affect your goals, cause strong emotions, or cause frequent emotions. So what's happening the most, what's the worst, what affects your goals the most. And I think Hillary Hendel said the exact same thing. I think she had the same exact 3 criteria of which things you should tackle first. That's good general advice for self-improvement. Like,
say the three criteria again.
So which, like, if it's a specific emotion, like let's say you wanted to do anger, what makes me the most angry? Like, what gives me the highest amount of anger? What gives me the most frequent instances of anger? So what makes it happen the most and what happens most often? Those are the 2. And then the third one is which kind of anger affects my goals the most and my goals in life.
Okay, cool.
This is good general advice. I like that.
Yeah, because if you tackle those things first, then all the other things are going to be easier to tackle because they're, well, partly because they weren't a big enough deal to begin with, but now also you've conquered something bigger, so whatever.
Yeah, because we might tend to just grab something random, you know, like there's a certain strategy that's good for cleaning your house, for example. If your house has gotten really messy and you're like, oh, fuck, it's gone too far. Now I'm doing repair. This is like repairing my house. You know, it's like, fuck, where do I start? And somebody who's really good at cleaning and just really balanced and conscientious, they can go, well, let's start with this and start with that. This is like a piece of advice like that. Like, don't just go to a random corner and start tidying up. Approach it like this. Write down a list. What makes you anxious the most often? What gives you the highest amount of anxiety? Which instances of anxiety affect your life goals the most? Let's write those lists. And then between those 3 lists, is there any anxieties that appear on all 3 or maybe 2 of those lists? And you can start with those, and this is going to improve your life the fastest. And then you feel like, okay, I've got this organized well enough that I can make significant progress here.
Yeah.
And it's anxiety reducing to have a plan.
I could also see the sort of the other side, the argument for starting with the smaller things would be like kind of like the snowball thing that they say about getting over your debts, or as Jordan Peterson,
debt stacking.
As Jordan Peterson has said about like improving your life, ask yourself, what could you do that you would do? What could you do to make your life better?
He's
that
such
you would
an asshole.
Actually do.
What could you do that you actually would do?
Yeah,
that's so funny. But that's definitely a different approach than this approach.
Totally.
Because this isn't saying what's a goal that you'll actually will tackle. It's saying like take the most important, biggest thing, and his advice is different, but likely more realistic.
Although if you could, I mean, I guess it does fit within his framework as well. If you could do that and would do the biggest thing, then do that.
Oh, for sure.
Yeah.
Yeah. Their framework is better if you can.
Yeah.
Dude, this is a really cool fun fact about exposure therapy. So there's 2 main approaches to exposure therapy, and one is like the really, really gentle kind that I talked about, and the other one, patient willing, you just absolutely dive in. Like it's like, hey, you know, you're afraid of rats, so we went to the store and we borrowed 4 rats, and you're gonna sit in a closet with them. That kind of like crash course exposure therapy, way more therapeutically effective than going the baby route. It's like the difference between jumping in a cold lake and putting your foot in the cold lake. Like it can almost weaken you to think that you have to inch into it if you are able to just say fuck it and just dive in. And that kind of reminds me of psychedelic assisted therapy. Like you can experience things on in psychedelic assisted therapy sessions that on trips that you can, like, if you said like, yeah, I experienced this and this, I mean, you could tell that to somebody and they'd be like, what? You'd be like, yeah, but I'm fine. I mean, I completely eliminated my fear of anything like that. I'm not afraid of death.
Yeah.
It's like, wait, you experienced what? And it just sounds completely bizarre. But I found that really encouraging to read because I like that approach better. Like, if I'm afraid of something, I would rather just try to, it just sounds like less effort to just go the balls out route. And just
it's less time at least.
Yeah.
Just jump in the pool of snakes.
Yeah, jump in a pool of snakes.
Yeah.
I mean, if they're not poisonous snakes, just do it. Just do it.
Yeah.
It's not, you'll be fine. Let's see. Oh, Xanax, Ativan, Klonopin tranquilize the amygdala and they interfere with exposure therapy. You can't do exposure therapy with those drugs because it won't take. Your brain won't even give a shit.
With which ones?
Xanax, Klonopin, and Ativan. Those are common anxiety drugs. So because they act as a tranquilizer, so that's not a total but partial tranquilizer on the amygdala. And so you're not actually training or reconditioning the amygdala by doing exposure therapy if you're on those drugs. And that's good to know because there's a lot of people who want to medicate with those drugs and say, well, Xanax allows me to go out in social settings. It does allow you to go out in social settings, but it doesn't allow you to learn how to go out into social settings.
Right.
You're just doing it. You're not learning how to actually do it.
When you stop taking it, the problem's still going to be there.
Yeah. It could even be worse because then you've taken the power and you've applied it to a physical object. And like just like we talked about in Cure, I'm glad we've gotten a couple chances to bounce back and forth. Cure is explaining that you can take power and you can power is like this psychological currency that you can store in a physical object, and then you can ingest that physical object and you can somehow benefit from that. So if you do that with and they also mention in Cure that Valium doesn't work if you don't know that you've taken it. And there was another really common anti-anxiety drug they mentioned that's barely better than placebos. Man, I can't remember which one it is. But that's a really good reason to be careful with drugs like that because you can convince yourself that you can only cope with situations if you take those drugs. Let's see. Prozac is barely better than placebos. But it's expensive, so you can get it everywhere.
Hell yeah.
I think I'm almost out of points on here. Oh, you never want to leave an exposure therapy session in fear because that will reinforce the anxiety. So if you ever choose to expose yourself to something you're afraid of, and then you want to back out, like let's say you are nervous to go to some kind of event because of the kind of people that are there, so you drive halfway there and turn around. You've become more anxious by doing that. Either don't go at all or just fucking follow through and go. Because if you go halfway and then you turn, if you get ready, you get in the car, you drive there, you get to the parking lot, you sit in the car, you're like, I can't fucking do this. Turn around and drive home. You've just conditioned yourself to be a more anxious person.
Right.
So if you're going to do the exposure therapy method, just wait until you're in a position, in a condition that you can just follow through. Because if you do it halfway, you're just going to make it worse.
Totally. No half measures.
No half measures. If you're lukewarm, I'll spit you out.
It also reminds me of the, what is it? It's from Dale Carnegie's How to Win Friends and Influence People. Shit, I already lost it. What?
Exposure therapy, can't go halfway,
Right.
No half measures.
You've watched yourself do this, and you've now made yourself kind of a reputation. You've given yourself a reputation by watching yourself almost do it and then pussy out. And so you'll keep in mind later that, well, I'm probably just not going to do it anyway.
Right.
Yeah.
Right. Absolutely. Oh, one of the reasons that consistent exercise reduces persistent anxiety is that it makes your body feel more comfortable with increasing heart rate and blood pressure. So if you don't exercise at all, then your heart rate and blood pressure go up when you get anxious, and your body goes, "What the fuck is this feeling?"
Mhm.
But if you consistently exercise and your heart rate and blood pressure go up, you're like, "I'm comfortable with my heart rate and blood pressure being at this level.
Mhm.
This happens when I exercise. Like I know how to function like this." And so if you're in a like I'm hoping to get back into motivational speaking soon.
Mhm.
I need to be exercising, ideally sprints. If I'm doing that, because then when I get nervous right before a talk, I'll go, yeah, I'm comfortable with this. I'm gonna just use this as fuel. But if I'm not used to my system buzzing at that level, then when it turns up, it'll make me uncomfortable.
Mhm.
Oh, he also, she distinguished between anxiety and worry. That that worry is the flavor of anxiety that involves negative future anticipation. I don't think it's just future, because you could worry about an unknown from the past, like, oh, I wonder what happened to so and so last night. I'm worried, but typically future.
I think that's more, but I think that's more that you're worried about the future when you're going to get that information.
Yeah, that's true.
How I would view that.
That's technically true. Yeah. Yeah, because you're worried about the experience you're going to have when you receive that information about what happened in the past.
Right.
Because you're not worried about what happened in the past. It happened either way.
Yeah, exactly.
Yeah,
I think.
that's interesting. And fear is like the difference between fear and anxiety is fear usually has a known source. Anxiety is usually an unknown source. We've talked about that. The anxiety is a hard thing to define because it basically means vague, uncomfortable feeling. That's pretty much what anxious means.
Right. It's almost the bucket that, like, I'm not sure what I'm tripping about goes into.
Right.
Yeah.
So no feeling is technically anxiety. Like, it's like, I'm feeling anxious. Well, then let's figure out what you're feeling. Let's figure out what you mean by anxious, because it's not, anxiety doesn't quite exist on its own.
Mm-hmm.
Unless you went with like the Kierkegaardian definition of anxiety, which is like, anxiety is the discomfort of free will. It's the discomfort of choice. The fact that we have any options, we have any choices, results in a sensation of uneasiness because there's no way to know if the right choice is being made.
Mm-hmm.
That Soren Kierkegaardian concept of anxiety defined it that way. So you could take it that way. You could say it's the unease that results from free will. And that's a good philosophical definition of it.
Yeah, I like that.
But to create a functional psychological definition of it without getting into the free will versus determinism philosophical debate, you can't define it that well. Because you say, well, why are you anxious? Well, I'm anxious because I haven't eaten, or I'm anxious because an event's coming up, or I'm anxious because so-and-so said this to me and I don't know what they meant. And it's like, okay, so you're really nervous, you're really worrying, you're really hungry. But calling it anxiety, it almost gives it more power to call it anxiety, because you're forfeiting your right to identify the sensation by calling it this blanket statement anxiety. It's like, well, if you formulate it more articulately, you can do more about it.
Totally. Yeah.
Last tip, thought replacements. Let's see, I wrote down page 185. Let's crack open one of these books.
And I will read 185 in this one, and we'll see which one's better.
Yeah, let's do it. Yeah. So, no, do it. So 185 here is, okay, so like an anxiety-inducing thought. There's no use trying. Things will never work out for me. So the coping thought, I'm going to try because then there's at least a chance that I'll accomplish something. Or anxiety-inducing thought, something's going to go wrong. I can feel it. Coping thought, I don't know what's going to happen, but these feelings are sometimes wrong. So this is just a rework of what the Stoic Toolkit by Chris Roberts called Be More Analytical, which is rely less on opinions and more on facts. So what this book calls that is use thought replacements from anxiety-igniting thoughts to coping thoughts. But what they really mean is from wrongful assumptions to factual truths. Just think more analytically. So that's an approach to mitigating cortex-based anxiety.
Oh, sure.
If you find ideas in your head, it's not enough to identify an idea in your head that's false and anxiety-provoking and say that's wrong. That's not enough. That's not how the brain works. You can't delete a thought. You can only replace a thought. So if every time the thought comes up, if you have a persistent thought that makes you anxious, if every time it comes up you go, that's false, I don't receive that. No, that's not. You have to recode it. It's not how you're not coded that way that you can just go, ignore. You need to take it and edit it. You need to edit the code and then hit save and then start reprogramming it to think that way instead. That's way more effective than trying to just shoo certain thoughts away.
I like that. Yeah. Are your check marks like this is a good sentence? This is the start of a good sentence?
Check marks?
Yeah.
Those aren't my check marks. I bought that used.
Okay, well, I'll start from the check mark.
Oh, yeah, please.
Epigenetics refers to a process in which DNA in a cell becomes physically modified or tagged in a way that controls long-term how genes in that cell are activated.
Wow.
So there we go.
That really helps me understand the power of the mind over the body.
Yeah, and that's The Power of Now by Eckhart Tolle.
So out of like 250 pages, I'm on 180. So I have a little more in this book. And then the next one I'm reading is Calming Your Anxious Mind by a doctor. No, sorry. The next one I'm reading is Relaxation Response. So by Dr. Benson. That one's really interesting to me because MIU kind of took a shot at him. So MIU has to be like territorial about transcendental meditation being the only meditation in the world. And they talked about, there's this Dr. Benson who invented the relaxation response, and it was like a knockoff of TM, and he was saying that it was better. And there is this like anti-TM article that is like, Dr. Benson made something better, and they refused to test it next to TM. And so I was...
It's a little cringe.
Yeah, they're both cringe.
Okay.
They're both cringe, right?
Oh,
like,
so he's saying the same sort of thing.
No, Benson's not being cringe. TM, like MIU and the TM org is being cringe and saying Benson's thing's not as good as our thing. And then this anti-TM website is being cringe and saying they just were scared that Benson's was better.
Oh, okay. Gotcha.
So they're all being cringe, but Benson is not. So Benson was I believe, Harvard physician who he wanted to get down to the physiological changes that occur as a result of meditation and find ways to trigger them that didn't have any kind of ideological or religious baggage. And I think he just nicknamed the parasympathetic nervous system the relaxation response. I haven't gotten far into the book.
Okay.
So I'm not sure, but he invented a method that is similar to TM in some ways because it involves the repetition of a mantra and presumably the transcendence of the mantra. But he allows people to just kind of pick their own mantras, and he adds a little ritual at the beginning with like progressive relaxation, certain kind of breathing, and then you use your mantra. But I'm really excited to read the book because as I was skimming it, he had posted an excerpt from a book on Islamic spirituality. And this book on Islamic spirituality was promoting a form of meditation. And here's how they described it. Mm-hmm. Sit in a place that's quiet, like in a corner where you're alone, where you don't have any distractions. And then do not cease from repeating Allah, Allah vocally until it travels from vocally to your thoughts, and then allow Allah, Allah, Allah to repeat in your thoughts until it ceases in your thoughts and it begins in your heart, and continue repeating Allah, Allah in your heart until it ceases repeating in your heart, and it gives you direct contact with Allah. This is not a time for the recitation of the Quran or for any other religious ideas. This is only a time to be alone with the Spirit of God itself. And it's like you're describing transcendental meditation.
So the same, yeah.
Using Allah, and the Allah is such an interesting holy word because it's like two letters from Atma, which is the Hindu and Vedic term for the absolute, and like two letters from Abba, which is Jesus's word for God. So and Aham is the mantra promoted by One Giant Mind, which is like the closest knockoff to TM that I have found. Mm-hmm. So there's something really interesting about that sound. And I'm thinking about using those mantras when I teach, because I want to teach people meditation, but I can't teach my TM mantras because I agreed to be chipped by the TM organization, and they can activate that chip if I share the mantra, and it'll make me retarded. So I was thinking that people could pick between Abba, Atma, Allah, Do you want to try a Muslim one or a Hindu one or a Christian one? These are just old sacred words. They all mean the same thing. Which one do you like?
I like that idea.
And
That's
then,
good.
and
Get
then
some real obscure ones. It's real diverse. That's a good way to do it. Yeah.
Yeah, and then you could use hypnotherapy to condition them to have a certain physiological response to the word that they choose, so that they don't go straying about using random different mantras, because it's very, very useful to use the same mantra every time. But the way that we're minded as modern Americans is like, we'll just use a different mantra every day just for variety. We're just dicks like that.
Yeah.
So you use hypnotic conditioning to induce the transcendent response when they use that mantra, so that they do have to use that mantra. So it's like you get the best of both worlds, because they're conditioned for that mantra to have a response, but they're also given the ability to freely choose their own mantra rather than being like granted one. Because if you grant someone a mantra, you're saying, I'm closer to God than you are, so let me tell you what mantra to use.
Yeah.
But if you don't give them a mantra, they won't stick to a mantra, and they won't get the benefits of having a consistent one. So I think that could be a way of kind of doing both.
I like it. That's a good idea.
So another book I'm covering soon is Mindfulness Hypnotherapy. I can't remember who wrote that one, but it's about how to use hypnotherapy to do mindfulness training. So I think I can kind of extract from all of these and then make something new. Maybe one mantra for internal meditation and one mantra to use as needed. Kind of like you have a steroid inhaler and a rescue inhaler if you have asthma. Not that I do. I'm not gay. And you could use one mantra for when you're meditating to transcend, and another mantra if you feel totally detached from the present moment, then you can use that mantra to bring you back into the present moment. You can use hypnotic conditioning to make both of them have that response. Okay, I'm just spitballing now. I'm ready to stop. Okay. Did you have something to say?
No, I don't have anything.
I swear you had something like 7 minutes of ranting ago.
What were you ranting about? What it looked like my face had a thought.
Benson secularizing meditation, trying to get down to the physiologic response.
Oh, that might be it, because I did think, I don't know if I was gonna say it, but I did think about how that sort of Benson and TM or MIU, it sort of reminded me of that idea where people were criticizing Eckhart Tolle and Jordan Peterson for being unoriginal, or like, well, it's true, so it should be unoriginal and just repackaged.
Right.
Maybe it was that. Yeah.
No, that is a really relevant observation, because the apparently the process of using a mantra to transcend thought entirely is not exclusive to the Vedic tradition. Unless I'll try to do enough research on that Islamic spiritualist, that author, to see if he might have been inspired by the Vedic texts. But apparently he's an extremely respected Muslim. Like, a lot of Muslims call him the greatest Muslim since Muhammad, and he's really, really respected. And he's like an orthodox classical Muslim that still can incorporate the deeper Islamic spirituality into his teachings. So it seems like that guy is going to be a great source for perspective on that, because the Muslim world to me is just like in a black box. Like, I don't know what the hell is going on in there. It's like it's wearing like a black cloak that covers its whole body. Like, I can't even recognize it. And I'm interested in I'm interested in the connections there. Like, what is Christian spirituality, Buddhist spirituality, and Islamic spirituality? What do they all have in common? So I think that book is going to lead us in some cool directions.
Sounds good. Yeah.
Yep.
Yep.
Nice, cool.
Nice, cool.